I worked a midnight shift in the emergency room as the solo nurse in a 12-bed remote hospital. We had to call in a doctor from home when we had a patient. Welcome to Health Hats, the podcast. I'm Danny Van Leeuwen, a two-legged, cisgender, old white man of privilege who knows a little bit about a lot of healthcare and a lot about very little. The way I got back into nursing is I was very concerned that even though I'd gone to nursing school and I had 4.5 years of being a professional nurse, I felt like I didn't know how to handle an emergency that might happen in our community, Jupiter Hollow, and was the name of the intentional community we lived in. And so I became a paramedic. So first I became a EMT, and then I became a paramedic. And we started we started working at the emergency squad. I got a job in the emergency room about maybe 30 miles away. There was a 12-bed hospital in Braxton County, and I worked in the emergency room there.
Is that
12
like
beds,
small?
tiny. It was tiny.
Yeah,
And
was the ER or the whole hospital?
the whole hospital was 12
Or was it
beds.
just an ER?
The inpatient part of and then they had an emergency department, which was staffed by one nurse. I worked midnight shift. We would have to call in a doctor if there was a patient. If somebody came in, like with the emergency squad, they would have to stay and help because there was only one other nurse working with the 12 patients. And it was pretty crazy.
I did want to ask you about the 12-bed hospital. Were you guys like busy at all? If it was just one nurse,
Well,
I can't imagine it.
there was a trickle of patients would come in, but then if there was like a heart attack and a car accident at the same time, that was a disaster.
Yeah,
Literally, then we would have to call people in, and it was a good job. I learned so much. You really gotta be prepared. You gotta manage.
do everything
You gotta
yourself.
anticipate. You gotta have the equipment.
Yeah,
It was insane. On the other hand, West Virginia being a third world state, meaning it was poor.
is that
What's that?
an actual term? A third world state is
I don't
an
know.
actual
It's
term?
what I say.
Oh,
It's what I mean by that is it's poor. The money is in the resources, wood, coal, gas, and it was sparsely populated, but there were 3 cities, Morgantown, Charleston, and Huntington. So the emergency services system was very well integrated and managed. I could call, I would call Charleston or Morgantown, and they would be on the radio. If I was there by myself and a doctor hadn't come yet, they would be available by radio that we had on speaker so that I could just talk while I was working, and they would be asking me questions about the condition of the person coming in or the people coming in, and they would advise me, and they would then like send an ambulance from somewhere else or send a helicopter. So it wasn't like I was alone.
Small hospital?
Even though I was alone. I host, write, and produce Health Hats the podcast, with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.